National Network for All, in short, CNN for All, Urbana, Illinois.
And Bethel House of Refuge, Muhammad, Illinois, USA, presents this week's breaking news in wellness and health for all people and all professionals. Hi, I'm the Pete of Dr. Z and Pete. Of course, this is Dr. Z. I am presently the CEO of Bethel House of Refuge in Muhammad, formerly Executive Director of a prison ministry in this area. And prior to that, Doc, I was president of a commercial construction business operating in the East Central Illinois area. This fellow right here, this looks like a doctor. This is my distinguished co-host, my friend, Dr. Alex Rima Zachariah. Doc is a medical professor as well and the CEO of CNN for All. Recently, Doc was a chief medical officer, the medical director of Provena, now Presence United Medical Center in Danville, Illinois in 2008, part of 2009. Prior to that, he was dean of one of the top 12 medical schools out of 300 plus medical schools in India, Christian Medical College, Ludhiana, India. Doc, with his wife Prema, also a retired physician and professor, specialized in maternal health and child care. They spent 43 years in Ludhiana, first as students and then as faculty, retiring in 2000. They've resided in Urbana since 2005. And Doc, bringing your expertise to the table and your outstanding resume, privileged to host this program with you. Why don't you tell the folks what we're about with breaking news in wellness and health?
Thank you for watching us. Please note this is not medical advice. This is for your information only. Do not change your treatment based on this info. You may mention this to your doctor, and you may even ask your doctor to watch the breaking news in wellness and health.
Absolutely. Ask them to watch. We want as many doctors watch as we can. If you'd like to communicate with us via email, you can do that. Breaking news at CNN4all.com, and you can write to us at...
Yes, breaking news, CNN for All, P.O. Box 17494, USA.
Okay, we're ready to roll. More breaking news. We're going to talk to you about a lot of things today, but first we're going to touch on diet. Both a Mediterranean diet and diets low in available carbohydrates protect against type 2 diabetes, studies suggest. New research shows, Doc, that a Mediterranean-style diet and diets low in available carbohydrates can offer protection against type 2 diabetes. What do you think about that?
The study is published in Diabetologia, the Journal of the European Association for the Study of Diabetes, in this month, August 2013, and is by Dr. Carlo Vecchia, Mario Negri Institute of Pharmacological Research in Milan, Italy, and colleagues.
Well, these authors studied patients from Greece who are part of the ongoing European Perspective investigation into cancer and nutrition. It's EPIC, led by Dr. Antonio Trichopopoulou, from, boy, try to say that 10 times, from the University of Athens. A total of 22,000 participants actively followed up for just over 11 years. 2,330 cases of type 2 diabetes recorded. That's not very many, Doc.
To assess dietary habits, all participants completed a questionnaire, and the researchers constructed a 10-point Mediterranean diet score, MDS, and a similar scale to measure the available carbohydrate or glycemic diet, GL. People with an MDS of over 6 were 12% less likely to develop diabetes than those with the lowest MDS of 3 or under. Patients with the highest available carbohydrate in their diet were 21% more likely to develop diabetes than those compared to a high MDS combined with low available carbohydrate, reduce the chances of developing diabetes by 20%.
That's great.
As compared with the diet low in diabetes and high glycemic index.
The role of the Mediterranean diet in weight control is still controversial, except, of course, for the Italians. And this study suggests that the protection of the Mediterranean diet against diabetes is not through weight control, but through several dietary characteristics of the Mediterranean diet. That's what you're eating and all of those things. So that's good news for those people in Italy and those of us that like Italian food. That's me. Check this out. Celery, artichokes contain flavonoids that kill human pancreatic cancer cells. Celery, artichokes, I love artichokes, and herbs, they call me herb, especially Mexican oregano, all contain apigenin and lutein, flavonoids that kill human pancreatic cancer cells in the lab by inhibiting an important enzyme, according to two new University of Illinois studies. That's right here in town.
Right, pancreatic cancer patients would probably not be able to eat enough flavonoid-rich foods to raise blood plasma levels of the flavonoid to an effective level, but scientists could design drugs that would achieve those concentration necessary for killing pancreatic cells.
Check this out, Doc. If you eat a lot of fruits and vegetables throughout your life, you'll have chronic exposure to these bioactive flavonoids, or flavonoids as my good friend says, which would certainly help reduce the risk of cancer. Lots of fruits, veggies, come on.
Yes,
that's where we're at, right? That's what we're all about at Wellness and Health. Breaking news in Wellness and Health. Let's go. We're still talking about those things. High debt, imagine that, could be hazardous to your health. I know that. If young people are drowning in debt, their blood pressure may be on the rise and their health could suffer. A new Northwestern medicine study has found that high financial debt is associated with higher diastolic blood pressure and poorer self-reported general and mental health in young adults. Go figure.
Today UIUC, the first day in the college.
Yeah.
The study published in the August this month, 2013 issue of Social Science and Medicine offers a glimpse into the impact debt may have on the health of young Americans. We now live in a debt-fueled economy. Since the 1980s, the American household debt has tripled. It's important to understand the health consequences associated with debt.
Absolutely. Here are some key findings of the study that 20% of participants reported that they would still be in debt if they liquidated all their assets. High debt to asset ratio, not good. Higher debt to asset ratio was associated with higher perceived stress and depression, worse self-reported general health, and higher diastolic blood pressure. Can you imagine, just from debt or the awareness of debt?
One wouldn't necessarily expect to see associations between debt and physical health in people who are this young. This study is the first to show that how debt may impact physical health.
And it's a good reason to examine what you're going to do well before you're going to do it. Make healthy choices involving encumbering yourself with more debt. Guess what? We're talking about coffee now. More than 28 cups of coffee a week may endanger health in people under 55. Nearly 400 million cups of coffee are consumed every day in America. Drinking large amounts of coffee may be bad for under 55s, according to a new study published in the Mayo Clinic Proceedings. A study of more than 40,000 individuals found a statistically significant 21% increased mortality in those drinking more than 28 cups of coffee a week. That'd be 4 cups a day. And death from all causes with a greater than 50% increased risk in both men and women younger than 55 years of age. Investigators warn that younger people in particular may need to avoid heavy coffee consumption. No adverse effects were found in heavy coffee drinkers aged over 55. Good news for me, I like my coffee.
The study is reported in the Mayo Clinic Proceedings, August 2013. A multi-center research team investigated 45,000 individuals, yes, this is aged between 20 and 87 years old between 1979 and 1998. The effect of coffee consumption on death from all causes and deaths from cardiovascular diseases were studied with an average follow-up period of 16 years. Younger men had a trend towards higher mortality even at lower consumption, but this became significant at about 28 cups per week, where there was a 56% increase in mortality from all causes.
Younger women who consume more than 28 cups of coffee per week also had a greater risk, a greater than a twofold higher risk of all-cause mortality than those who did not drink coffee. Younger people, in particular, is what this is saying, ought to be avoiding heavy coffee consumption of more than 28 cups a week or 4 cups in a typical day. So young people, be careful. Yo, Doc, you got a song for us?
Yes.
Okay.
Eat more.
Eat more?
Yes, eat more.
I thought we were about managing diet.
More of veggies, whole grains, fruits. Go nuts on nuts.
I'm good for nuts. I'm all for nuts.
Eat more.
Eat more?
Yes, eat more.
More of?
More of veggies, fruits,
Fruits.
whole grains,
And
go
nuts on nuts?
nuts on nuts.
I'm for that.
Exercise more. Walk, jog, run, bike. Treadmill, elliptical, till soaked in sweat. Exercise more. Walk, jog, run, bike. Treadmill, elliptical, till soaked in sweat.
I'm for getting soaked in sweat.
Eat less.
Eat less?
Yes, eat less.
Eat less.
Less of fried food,
Oh, okay.
starch, sugar. Say no to
soda pop?
soda pops.
Yep.
Eat less.
Yes.
Yes, eat less.
Less
Less of fried food, starch, sugar. Say no to soda pop. Exercise more, 5 times a week, half hour or more, till soaked in sweat.
Don't quit your day job.
Exercise more, 5 times a week, half hour or more, till soaked in sweat.
Pavarotti left the studio. Listen, we'd like to thank the people from Science Daily for the information that they've given us. We'd also like to thank the City of Urbana's UPTV production coordinator, Jason Liggett, production intern, Caleb Serpenis, and, of course, the UPTV station manager, Jake Schumacher. And we want to thank you all for watching us, and we'll be back soon.
I don't think it's possible to know much about the third world unless you've been there, unless you've been to a country and seen conditions. Maybe that's why I joined Peace Corps. You can't help but learn something from living with other people. You know, you never know what you can do until you do it. I may not ever do this again, but I did it once.
It may not be the easiest 2 years of your life, but it sure could be the most rewarding. Call us toll-free. Peace Corps, the toughest job you'll ever love.
Compassion Now Network for All, in short, CNN for All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, USA, presents this week's Breaking News in Wellness and Health for all people and all professionals. I'm the Pete of Dr. Z and Pete, and this is my distinguished co-host, Dr. Alex Rama Zachariah, MD. Doc is also a medical professor and the CEO of CNN for All. So we've got a lot of medical experience here, all right? Let's get right to it, our breaking news. Non-smoking women breastfeeding for more than 6 months may protect against breast cancer. A new analysis, Doc, has found that breastfeeding for more than 6 months may safeguard non-smoking mothers against breast cancer. The same does not seem to hold true for smoking mothers, though. Published early online in the Journal of Clinical Nursing, the findings add to the list of benefits of breastfeeding for women and for their babies. highlight non-smoking.
The study from the University of Granada in Spain is published in the Journal of Clinical Nursing, August 2013. The team analyzed the medical records of 500 female patients who were 19 to 91 years of age and who had been diagnosed and treated for breast cancer from 2004 to 2009 at the San Cecilio University Hospital in Granada. The team looked at factors including age of diagnosis, how long the women breastfed, family history of cancer, obesity, alcohol consumption, and smoking habits.
My goodness. The results suggest that for non-smokers, breastfeeding for more than 6 months not only provides children with numerous health benefits, but it also may protect the mothers from breast cancer. Good news.
So,
That, you know, that wasn't always going on in the U.S. A lot of them were doing bottles, but now they're moving back because they see the great benefits both for baby and mother for breastfeeding. Containing infectious disease outbreaks. That's one of the things we're interested in. Researchers at the University of East Anglia have identified a rapid response which could help halt infectious diseases such as bird flu, swine flu, and SARS before they take hold. The UEA is a public research university based in Norwich, United Kingdom.
focusing on the avian flu virus strain H5N1, research published in August this month, 2013, in the journal PLOS ONE, identifies key stages in poultry trade chain which lead to its transmission to other birds, animals, and humans. The H5N1 avian flu strain has been responsible for the deaths of millions of poultry, as well as 375 confirmed human deaths. Areas of Southeast Asia have been hardest hit, with more than 2,500 reported outbreaks among domestic poultry, like in Vietnam alone.
Dirty chickens. The disease has also spread rapidly from Southeast Asia into Europe. However, the way that the virus transmits from poultry to humans has been poorly understood. High-risk times for the disease to spread include during transportation, slaughter, preparation, and consumption. So there isn't a place where you're not at risk if you have dirty birds. Study identified poultry, transportation, slaughter, preparation, consumption as critical control points. This represents a significant global health threat and also creates a burden to public health systems and the global economy. Oh my goodness, man.
So they can come even to United States.
Absolutely. Transportation,
Yes.
preparation. And be careful when you're handling and preparing chicken. Here's some good news. Spicing up your fish fillets with science of aquaculture industry. The health benefits of consuming omega-3 long-chain polyunsaturated fatty acids such as EPA and DHA are well established. The primary sources, Doc, and I'm sure you know this, of these fatty acids in the human diet are through fish and seafood. Bring on the shrimp and the red snapper. Researchers at the University of Saskatchewan Department of Animal and Poultry Science, well, that was a mouthful, are studying new methods of improving the fatty acid composition of farmed fish. You know, Sam's has farmed salmon.
The paper is published in the Canadian Journal of Animal Science, August 2013. As wild fish stocks are declined, the aquaculture industry has become one of the fastest growing animal production sectors. This growth has increased demand for aquaculture feed production, which has caused further demand for fish oil. Historically, fish are fed fish oil to increase levels of EPA and DHA. However, the fish oil supply is static and the cost has increased, and the industry is seeking low-cost alternatives such as vegetable oil.
Not nearly as good. The study looked at the addition of coriander oil to vegetable oil-based diets to increase the bioconversion of alpha-linolenic acid to EPA and DHA. Study shows that the addition of coriander oil to vegetable oil diets has the potential to improve the filet fatty acid composition of farmed fish. Good news for fish farmers.
I love fish.
I do too. Absolutely. Hey, we're talking about more coffee. Coffee and tea may contribute to a healthy liver. Surprise, surprise, your morning cup of coffee may be doing more for you than just perking you up before work. And the international team of researchers led by Duke NUS Graduate Medical School and the Duke University School of Medicine suggests that increased caffeine intake may reduce fatty liver in people with non-alcoholic fatty liver disease, NAFLD.
Rohit Anthony Sinha and team will publish their findings in Hepatology next month, September 2013 issue. Worldwide, 70% of people diagnosed with diabetes and obesity have non-alcoholic fatty liver disease. The major cause of fatty liver not due to excessive alcohol consumption. It is estimated that 30% of adults in the United States have this condition, and its prevalence is rising like in countries like Singapore. There are no effective treatment for NAFLD except diet and exercise.
More diet, change, and exercise. Findings suggest that consuming the equivalent caffeine intake of 4 cups of coffee or tea a day may be beneficial in preventing and protecting against the progression of NAFLD in humans. But that means young people consume 4, but no more than 4.
No more.
Right. Man, we still have more breaking news in wellness and health. Middle-aged men, women not equal in heart attack risk. High cholesterol levels are much more risky for middle-aged men than middle-aged women when it comes to having a first heart attack. A new study of more than 40,000 Norwegian men and women has shown this to be actually accurate.
Eric Madsen and team from the Norwegian University of Science and Technology published their findings in Epidemiology, journal August 2013. From 1995 to 1997, blood sample collection from 65,000 people in Norway, and in the study, 23,000 women and 20,000 men studied. There were 157 new cases of heart attacks in women and 500 plus in men.
The findings suggest that middle-aged men with an unfortunate cholesterol profile have a significant additional risk of myocardial infarction than what previously had been thought, and that these men should be treated much more aggressively than what often is the case today, so that more infarctions can be prevented and lives can be saved. All right.
Yes, that is something we just need to really take note.
All right, we'll be back in a moment. Hey, Doc, I see you brought back our 2 visiting MDs with you. Why don't you introduce him? He's cleaned up a little bit, been to the barber.
I'm Dr. Yoha, and I'm Dr. Charles Dalton, and we are biofeedback specialists.
Biofeedback?
That's right, that we are biofeedback specialists.
Somebody told me you were also singing MDs.
Yeah, we do mostly singing. That's right.
All right, are you going to give us a sample?
We do more singing than talking.
All right.
Eat more. Yes, eat more.
Eat more?
That's right. Eat more. Yes, eat more. More of veggies, whole grain. Yes, fruits. Go nuts on nuts.
I'm all for that.
Yes, eat more. Yes, eat more.
Doc's been eating more.
More of veggies, whole grains, fruits. Go nuts on nuts.
All right.
Exercise more. Walk, jog, run, bike, treadmill, elliptical, till soaked in sweat. That's right. Exercise more. Walk, jog, run, bike, treadmill, elliptical, till soaked in sweat.
All right, I'm for soaked in sweat, Doc.
Yeah, there's a little more. Eat less.
Eat less?
Yeah, eat less. Less of fried foods, sugar, starch.
And no.
No to soda thought.
That's right.
That's right. Eat less. Yes, eat less.
Remember that, Doc.
Less of fried food, starch, sugar.
And-
Say no to soda thought.
Yep, we got to say no to that.
Exercise
more,
more, 5 times a week. Half hour or more, till soaked in sweat. That's right. Exercise more.
Come on, Doc.
5 times a week. Half
hour
hour or more, till soaked in
sweat.
sweat.
Thank you, fellas. Thanks for coming. You're looking good, Dr. Yoha. We want to thank Science Daily and also thank the City of Urbana's UPTV production coordinator, Jason Liggett, production intern, Caleb Serpenis. How was that, Caleb? And the UPT station manager, Jake Schumacher. Thanks for watching us. We'll be back next week with more breaking news in wellness and in health.
Thank you for watching us.
Thanks for coming, Doc.
Yeah.
We'll see you next time.
That's right.